Question 1. A patient with chronic heart failure is being discharged. Which follow-up action should be prioritized? A. Referral to a dietitian. B. Scheduling a follow-up echocardiogram. C. Educating on daily weight monitoring. D. Reviewing insurance coverage. Answer. C. Educating on daily weight monitoring. Question 2. Which statement by a UAP caring for a heart failure patient requires intervention by the nurse? A. I'll help the patient get up slowly to avoid dizziness. B. I'll weigh the patient after breakfast. C. I'll record the intake and output every shift. D. I'll help the patient with oral hygiene. Answer. B. I'll weigh the patient after breakfast. Question 3. The nurse is preparing to administer morning medications to a heart failure patient. Which action is most important? A. Giving furosemide on an empty stomach. B. Checking potassium level before giving digoxin. C. Crushing extended-release metoprolol for easier swallowing. D. Administering all medications at once. Answer. B. Checking potassium level before giving digoxin. Question 4. Which sign in a patient with right-sided heart failure should the nurse report immediately? A. Nausea and bloating. B. Jugular vein distension. C. Decreased urine output. D. Pitting edema in ankles. Answer. C. Decreased urine output. Question 5. Which dietary instruction is essential for a patient with heart failure? A. Increase potassium-rich foods. B. Avoid whole grains. C. Use salt substitutes freely. D. Limit sodium intake to 2 grams daily. Answer. D. Limit sodium intake to 2 grams daily. Question 6. A nurse is planning care for a patient with heart failure. Which goal is most appropriate? A. The patient will drink 3 liters of fluid daily. B. The patient will report improved energy after rest. C. The patient will maintain weight within 2 pounds of baseline. D. The patient will avoid all physical activity. Answer. C. The patient will maintain weight within 2 pounds of baseline. Question 7. A nurse delegates daily weight measurement to a UAP. What instruction is most important? A. Weigh after breakfast. B. Use a different scale if needed. C. Weigh the patient at the same time daily. D. Record weight in patient's medication list. Answer. C. Weigh the patient at the same time daily. Question 8. A patient with heart failure is receiving carvedilol. What assessment finding warrants holding the medication? A. BP 142/88 mmHg. B. HR 54 BPM. C. Weight loss of 1 pound. DRR 18 breaths/min. Answer. B. HR 54 BPM. Question 9. Which activity can the nurse appropriately assign to an LPN/LVN caring for a heart failure patient? A. Developing the care plan. B. Assessing for crackles in the lungs. C. Reinforcing discharge teaching. D. Titrating for dopamine. Answer. C. Reinforcing discharge teaching. Question 10. A nurse is assessing a patient with heart failure. Which assessment finding requires immediate follow-up? A. BP 110/70 mmHg. B. Pulse oximetry 88% on room air. C. 2+ pedal edema. D. Weight gain of 1 pound overnight. Answer. B. Pulse oximetry 88% on room air. Question 11. A patient asks why they need both a beta blocker and an ACE inhibitor for heart failure. What is the best response? A. They both lower blood sugar. B. They reduce fluid buildup. C. They work differently to improve heart function. D. They prevent heart attacks. Answer. C. They work differently to improve heart function. Question 12. Which change in condition should be reported first for a patient with heart failure? A. Increased abdominal girth. B. BP drop from 130/80 to 110/72. C. Increased appetite. D. Mild fatigue after walking. Answer: A. Increased abdominal girth. Question 13. Which of the following is most appropriate for a heart failure patient on fluid restriction? A. Encourage hard candy to manage thirst. B. Allow unlimited gelatin. C. Increase fluid intake when taking medications. D. Offer large quantities in the morning. Answer: A. Encourage hard candy to manage thirst. Question 14. What is the nurse's priority when a heart failure patient has new onset crackles and dyspnea? A. Apply oxygen and raise the head of bed. B. Call respiratory therapy. C. Check potassium level. D. Administer cough suppressant. Answer: A. Apply oxygen and raise the head of bed. Question 15. A patient with heart failure reports taking over-the-counter NSAIDs for joint pain. What is the nurse's best response? A. That's fine as long as you eat with them. B. NSAIDs can cause fluid retention and worsen your condition. C. You should take them only at bedtime. D. They are safe when taken every other day. Answer: B. NSAIDs can cause fluid retention and worsen your condition. Question 16. What is the primary benefit of beta blockers in heart failure treatment? A. They increase heart rate. B. They raise blood pressure. C. They reduce myocardial oxygen demand. D. They promote diuresis. Answer: C. They reduce myocardial oxygen demand. Question 17. A heart failure patient is prescribed a low-sodium diet. Which statement requires follow-up? A. I'll avoid processed meats. B. I'll eat fresh fruits and vegetables. C. I can still eat canned soup daily. D. I'll read labels for sodium content. Answer: C. I can still eat canned soup daily. Question 18. A heart failure patient is scheduled for a diagnostic test. Which one evaluates ejection fraction most accurately? A. Chest X-ray. B. ECG. C. Echocardiogram. D. CT scan. Answer: C. Echocardiogram. Question 19. Which behavior by the nurse promotes adherence to heart failure self-care at home? A. Providing a list of all dietary rules. B. Encouraging the patient to call for all questions. C. Involving the patient in developing the care plan. D. Emphasizing medication side effects. Answer: C. Involving the patient in developing the care plan. Question 20. What is the purpose of measuring BNP, B-type natriuretic peptide, in a heart failure patient? A. To assess liver function. B. To evaluate fluid status. C. To detect myocardial infarction. D. To determine blood viscosity. Answer: B. To evaluate fluid status. Question 21. A nurse is caring for a patient with acute heart failure. Which intervention is the priority? A. Administer prescribed diuretics. B. Monitor oxygen saturation. C. Increase 4 fluids. D. Assess for pitting edema. Answer: B. Monitor oxygen saturation. Question 22. A patient with heart failure is experiencing shortness of breath and a dry cough. What is the nurse's priority action? A. Increase oxygen flow rate. B. Check lung sounds for crackles. C. Assess for fluid retention. D. Administer a bronchodilator. Answer: B. Check lung sounds for crackles. Question 23. A nurse is teaching a heart failure patient about managing fluid intake. Which statement requires further teaching? A. I should drink no more than 1.5 liters of fluids daily. B. I can drink coffee and tea as part of my fluid intake. C. I can include ice chips to help with fluid restriction. D. I should weigh myself every morning before breakfast. Answer: B. I can drink coffee and tea as part of my fluid intake. Question 24. Which clinical finding in a patient with heart failure should be reported immediately? A. BP 120/78 mmHg. B. 3+ pitting edema in lower extremities. C. Increased jugular vein distension. D. A dry, non-productive cough. Answer: D. A dry, non-productive cough. Question 25. The nurse is preparing a teaching plan for a patient newly diagnosed with heart failure. Which intervention is most important to include? A. Teach the patient to monitor daily weights. B. Encourage increased sodium intake to prevent dehydration. C. Recommend the patient take rest periods only when symptoms worsen. D. Instruct the patient to limit potassium-rich foods. Answer: A. Teach the patient to monitor daily weights. Question 26. A patient with heart failure has a potassium level of 5.8 milliequivalent/L. What should the nurse do first? A. Administer a potassium-wasting diuretic. B. Notify the healthcare provider. C. Encourage potassium-rich foods. D. Increase 4 fluids. Answer: B. Notify the healthcare provider. Question 27. A heart failure patient is taking enalapril. Which side effect should the nurse prioritize monitoring for? A. Nausea. B. Swelling of the face or lips. C. Constipation. D. Headache. Answer: B. Swelling of the face or lips. Question 28. A patient with heart failure reports increased shortness of breath and coughing up pink, frothy sputum. What should the nurse do first? A. Administer prescribed diuretics. B. Apply oxygen and raise the head of the bed. C. Assess for pitting edema. D. Monitor the patient's blood pressure. Answer: B. Apply oxygen and raise the head of the bed. Question 29. Which finding is consistent with right-sided heart failure? A. Crackles in the lungs. B. Jugular vein distension. C. Shortness of breath. D. Decreased heart rate. Answer: B. Jugular vein distension. Question 30. A nurse is caring for a patient with heart failure and a prescribed low-sodium diet. Which meal choice indicates that the patient needs further education? A. Grilled chicken with baked potato and steamed broccoli. B. Tuna salad with low-fat mayonnaise and whole grain crackers. C. Fresh fruit salad with low-fat yogurt. D. Spaghetti with marinara sauce and garlic bread. Answer: D. Spaghetti with marinara sauce and garlic bread. Question 31. The nurse is assessing a heart failure patient's lab results. Which result requires immediate intervention? A. Potassium level of 4.5 milliequivalent/L. B. BUN level of 18 milligrams per deciliter. C. Sodium level of 130 milliequivalent/L. D. Creatinine level of 0.9 milligrams per deciliter. Answer: C. Sodium level of 130 milliequivalent/L. Question 32. Which intervention should the nurse prioritize for a patient with heart failure and edema? A. Encourage ambulation to promote circulation. B. Limit the patient's fluid intake to prevent overload. C. Administer prescribed diuretics as ordered. D. Apply compression stockings to the legs. Answer: C. Administer prescribed diuretics as ordered. Question 33. A nurse is assessing a patient with heart failure. Which finding requires the nurse to notify the healthcare provider? A. Oxygen saturation of 92% on room air. B. A weight gain of 2 pounds in 1 day. C. Heart rate of 70 BPM. D. Mild fatigue with activity. Answer: B. A weight gain of 2 pounds in 1 day. Question 34. A patient with heart failure has a prescription for spironolactone. Which action is most important for the nurse to take? A. Monitor for signs of hyperkalemia. B. Assess for signs of dehydration. C. Instruct the patient to increase fluid intake. D. Monitor the patient's blood glucose levels. Answer. A. Monitor for signs of hyperkalemia. Question 35. A nurse is preparing to administer digoxin to a heart failure patient. Which finding requires the nurse to hold the medication? A. Apical pulse of 50 bpm. B. BP of 130/80 mmHg. C. Potassium level of 3.2 milliequivalent/L. D. Respiratory rate of 16 breaths/min. Answer. A. Apical pulse of 50 bpm. Question 36. A heart failure patient is being discharged with a prescription for furosemide. What is the most important instruction the nurse should provide? A. Take the medication with meals to reduce stomach irritation. B. Increase your fluid intake while taking this medication. C. Monitor your weight daily and report any sudden weight gain. D. Avoid any physical activity until your symptoms resolve. Answer. C. Monitor your weight daily and report any sudden weight gain. Question 37. A heart failure patient reports fatigue and dizziness after standing up. What is the nurse's best intervention? A. Assess orthostatic blood pressure. B. Encourage the patient to sit up slowly. C. Administer a dose of 4 fluids. D. Instruct the patient to increase sodium intake. Answer. A. Assess orthostatic blood pressure. Question 38. A nurse is caring for a patient with heart failure and hyperkalemia. Which medication should the nurse question? A. Spironolactone. B. Furosemide. C. Lisinopril. D. Digoxin. Answer. A. Spironolactone. Question 39. Which action is most important for the nurse to take when a patient with heart failure shows signs of pulmonary edema? A. Administer for morphine as ordered. B. Elevate the head of the bed and administer oxygen. C. Administer prescribed digoxin. D. Encourage coughing and deep breathing. Answer. B. Elevate the head of the bed and administer oxygen. Question 40. A heart failure patient asks about the benefits of ACE inhibitors. What is the nurse's best response? A. They help prevent potassium imbalances. B. They improve blood flow by relaxing blood vessels. C. They help your kidneys function better. D. They increase the strength of your heart contractions. Answer. B. They improve blood flow by relaxing blood vessels. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!